The history of drug addiction in the United States dates back to the 19th century, when opium became a popular recreational drug. Since then, drug addiction has evolved in many ways, with different drugs coming in and out of popularity over the years. Today, drug addiction is a major public health crisis in the United States, with millions of people affected by drug use disorders. Opium was first introduced to the United States in the early 1800s, and it quickly became a popular recreational drug. It was commonly used in medicines, tonics, and elixirs, and was readily available at pharmacies and general stores. The use of opium was largely unregulated until the early 20th century, when the government began to crack down on the drug trade. In the late 19th and early 20th centuries, other drugs began to gain popularity in the United States. Cocaine was introduced in the 1880s and was used in a variety of products, including medicines, toothache drops, and even Coca-Cola. Heroin was introduced in the early 1900s as a substitute for morphine, which had become a problem for doctors who were prescribing it too liberally. During the early 1900s, drug addiction began to be viewed as a problem in the United States. The government passed a series of laws aimed at regulating the drug trade and limiting access to drugs. The Harrison Narcotics Tax Act of 1914 required doctors and pharmacists to register with the government and pay a tax on the drugs they dispensed. The act also made it illegal to distribute drugs without a license, and it gave the government the power to seize drugs that were being used illegally. In the 1930s, the use of marijuana began to spread in the United States. The drug was widely used among jazz musicians and was seen as a relatively harmless drug. However, the government began to crack down on marijuana use, and it was eventually made illegal in 1937. During the 1960s and 1970s, drug addiction became a major social issue in the United States. The use of drugs like marijuana, LSD, and amphetamines became widespread among young people, and drug addiction was seen as a sign of rebellion against authority. The government responded with a war on drugs, which was aimed at reducing drug use and drug addiction. Despite the efforts of the government, drug addiction continued to be a problem in the United States. In the 1980s, crack cocaine became a major issue in urban areas, and the use of heroin and other opioids began to rise. The government responded with tougher drug laws and mandatory minimum sentences for drug offenses. In the 1990s and 2000s, the pharmaceutical industry began to aggressively market prescription painkillers like OxyContin and Vicodin. These drugs were heavily prescribed by doctors and were widely available, leading to a sharp rise in opioid addiction. In recent years, the use of heroin and fentanyl has skyrocketed, leading to a public health crisis in the United States. Today, drug addiction continues to be a major problem in the United States. Millions of people are affected by drug use disorders, and the number of drug-related deaths continues to rise. The government has responded with a variety of initiatives aimed at reducing drug use and addiction, including increased funding for addiction treatment programs and expanded access to medication-assisted treatment. In conclusion, drug addiction in the United States has a long and complex history that spans over 2 centuries. While the drugs that are popular and the laws that govern them have changed over time, drug addiction remains a significant public health crisis. It is up to all of us to work together to reduce drug addiction and help those who are struggling with substance use disorders. Please do subscribe. I said please.